Good afternoon. I'm Joanne Singleton. I work for the state of Alaska in the Department of Health, the Division of Public Health, in the section of Women's, Children and Family Health. I'm a public health specialist. I'm going to talk today about adolescent healthcare transition and thinking about how we teach adolescents different skills and give them different tools to really help them start planning and practicing for moving into adult healthcare. So when we talk about healthcare transition, oftentimes the topic is focused around adolescents who have some kind of special healthcare need, and they're moving from pediatric care to adult care. And so this is a process of trying to teach the adolescent how to get ready for moving from one system of care to another. In the beginning, though, it's really helpful for adolescents just to learn how to be healthy in general, and how this all relates to themselves. So what are their physical, their emotional, their mental, their spiritual needs, and then the different types of relationships they have, not just with themselves, but with others, with their community and their culture. So it's really a time for exploration, and being able to ask questions while they're living at home and maybe trying to find out about new things, new ways of coping with difficult situations, making decisions in a way that they've maybe not made decisions before. So, I mean, really, this part of looking at healthcare transition is appropriate for any adolescent, because at some point every adolescent is going to need to go to the doctor or the dentist. They're going to have to pick up a prescription. They're going to have to learn how to use a health insurance and understand what the limitations are and how to figure out what their benefits are. So there's lots of aspects of this that is good for any adolescent to learn, not just those who have healthcare needs. So if we think about adolescent transition, you can think of it in similar ways to what happens when adolescents go to school. They're learning and they're preparing for what comes after school. So during the teenage years, this is the perfect time to help adolescents really prepare for becoming an adult with some kind of healthcare need. It's also a great time to help develop skills and knowledge, help them to be a little bit more independent as they're learning, how do I make a doctor's appointment? Or what do I need to do in order to get to my doctor's appointment? If you need to take public transportation, figuring out the bus timetable and seeing what time you might need to leave your house in order to be able to be on time for your appointment. And the other key thing about this is it's really a time to help support the adolescent as they're learning these things. If you think about a teenager who is learning how to drive, we don't just give the keys to the child when they're 17 and they've got their license and say, good luck, have fun. We spend time preparing them, practicing with them, having them go through the motions of what it means to be able to drive a car and make good decisions, and also learn the rules of the road and, what you have to do at a stoplight or, as you're merging onto the highway. So this is really a time to help teach adolescents the things that they need to know in order to be successful as they're moving around in the healthcare system. And even as adults, we all know how difficult navigating the healthcare system can be. So think of this as a process. It's not just you're going to be teaching them this information once, but it's information that they're probably going to want to be told and have the opportunity to practice being involved with over and over again, just so that they can feel more confident about, making an appointment or picking up prescriptions, asking questions of healthcare providers like, why am I here? Why is this important to me? Those kind of things. The other important thing to think about is as we learn how to make decisions, we have to have the opportunity to practice making decisions. And this can definitely be something that we learn over time. So if you think back to when your child was a toddler, they didn't just know how to dress themselves. You had to teach them from the beginning. You start with your socks and then your shoes. And in the beginning, they probably just had Velcro on their shoes because it was easy for them to manage, and before progressing up to having laces and learning how to tie knots. I think the difference for us when we are thinking about this in terms of teenagers and the learning process is the teenager is much more engaged. They have more thoughts and more opinions, and they want to be more active in their own life and in their own decision making. And so sometimes it can be tricky as you're trying to negotiate back and forward what the parent does for the child in terms of their healthcare needs and what the child needs to start learning. You know, if it's a child who has formula that they have to mix every day, and the parent has done the formula mixing forever, it can be a challenge then to try and get a teenager to start being involved in doing that themselves, or setting out their pill box and you know, putting out all their pills for the whole week in a box, so that way they're learning how to read the prescription and making sure that they're taking the right dose and the right pill at the right time. The pill box is also a great tool for helping parents to monitor what a teenager is doing without nagging them and asking them all the time, have you taken your pills? Have you taken your pills? Because you can just look in the box and see if the pills are gone for the day. Hopefully that means that they've taken them. But so there's different tools that you can use that will really help build up the teenager's confidence, but also for you as the parent or the caregiver. You've obviously spent a lot of time helping take care of this child and you want them to be successful, but it's hard to let go and to trust that they're going to do a good job and that they're going to manage. And so it's also finding ways of like sharing responsibility so that you also feel comfortable with the progress that they're making as they move towards becoming more independent in their care. So this is a great tool, Ask Me 3. It's a health literacy tool, which has basically been designed to try and help people who are going to see healthcare providers be more involved in their care, and also to help providers ensure that they are giving information to people that they can actually use and understand. Because there's oftentimes, you've probably been to a doctor's office, or you've had a healthcare provider who started talking to you about a problem, and you really don't know or understand what it is that they're talking about, and you're either embarrassed or you're shy or you just don't want to speak up because they're on a roll, and then you can sometimes feel like you leave that appointment and you really have no idea what it was that they were talking about. And as a healthcare provider, they really have a responsibility to make sure that you know and understand what it is that's being recommended, because you're only going to be successful in your treatment if you know and understand why you should be doing something. So these questions are great questions, and you can write them down before you go in for an appointment. And then, especially for adolescents, these are very straightforward questions to have them ask the healthcare provider they're seeing. So what is my main problem? And then having them explain what the provider sees as the main problem. And then this also gives you as a caregiver and also the adolescent the opportunity for them really to say if you do feel that this is your main problem, or if there's something different that you would actually like to discuss. Because sometimes the healthcare providers are very focused on one thing, but that's not actually what you want to talk about. And so this is a really good tool for helping you to be able to advocate for yourself, and really to try and get the answers to questions or concerns or things that are making you anxious, to really help you, focus on that. Once you've established what the problem is that you're talking about, then the next question would be, what do I need to do? So the key with this one is to make sure that when the healthcare provider is making recommendations, that they're talking in a way that you know and understand what it is that they're telling you you need to do, whether that's to change your diet, get more exercise, take a particular medication, go and see another provider or have a different test. It's really important that when you come out of that appointment, you know what they are recommending, because then you're going to be in a better position to know if it's something that you want to follow up on. And then with that, the third question would be, why is it important for me to do this? So it's really understanding the reason for the recommendation and how the provider thinks this is going to make you feel better or treat whatever the problem is. And again, this is key. If you're not having a good enough explanation as to why you should be either taking a medicine or doing a particular thing, like changing a behavior, maybe stopping smoking, if you don't understand maybe what the risks and the benefits of that are, it's much harder for you to be willing to make a change that might be a positive one for you, but also just to be able to make that decision for yourself in terms of like how you want to take care of a specific need. So I've also put in here some other tools that you can use, especially for you as a caregiver or a parent who's working with an adolescent. There is another booklet that Stone Soup Group has access to that has all kinds of different checklists and resources that can be very helpful as you are working with providers and your adolescent is working with the providers as well, to like understand exactly what their process is as your child gets closer to being 18. You know, one of the big questions is 18 the hard stop for seeing your child, or can they go until they're 21? Or are you in a family practice office? In that case, you'll continue to see the same providers, but you'll still need to transition over from you as a caregiver or parent being the one consenting for treatment to your adolescent when they turn 18 consenting for treatment and learning how to do that. And if there's questions of guardianship, working far enough ahead of time before the child turns 18 so you make sure that there's a continuation, that you're able to continue to get care for your child as you need, and somebody is able to consent for that care. So this is a really good tool for just some questions and they're just suggested questions. I mean, people have different ideas, especially based off of specific treatment plans or needs that they have. But starting to think about asking those questions of providers, and you can start, really the transition process. It's ideal if you start at around 12, 13, 14, because that gives you up to 4 years to start planning and working on how this process is going to be for you and your child, as well as for the provider as well, because maybe they're not used to actually doing transition as a process. Are they going to help you with finding an adult provider? And if they are they going to be able to then meet with that adult provider to talk about your adolescent and give them information about their medical history and what works well and what's been a challenge and what your strengths are and what you might need some extra help with. This shared responsibility tool is a great one that you can print out and put on a fridge. And again, this one, it's ideal if you start it, you can actually start it much younger. So you can have children who are 5 and 6 who need medications. You can help them, if you have medications that they need to take, you can start developing routines and ways for them to get used to the idea that these are medications they need to take every day, and it's just part of their morning routine. And then as they get older, you can use the pillbox, like I said before, and teach them how to fill the pillbox, and that can be something you can do together. And then as the adolescent becomes older and is more independent, then they can do the pillbox by themselves, and they can take the medicine and not have parents and caregivers be as involved. The same with if you need to do lab draws or make doctor's appointments. These are things that you can, like, as a caregiver and parent, you've done forever, and you know how to do it without thinking about it. You know where all the phone numbers are, you know who the names of all the providers and where their locations are. But this is a time to start thinking about, well, how do you share the knowledge you have that's sometimes just in your own head, so that your adolescent and other members of the family who might also be helping to support with independence learning, they know where to access information. So do you have maybe a binder that has medical records in it from years gone by and the different providers you've seen? And in there you put information about who the current providers are and their names and their phone numbers and the addresses and the last time that you saw them and the next appointment that's been booked. Because again, these are things that as an adult, you've been doing them for so long that it's almost second nature for you. But the adolescent needs to learn and really become aware of the amount of work it's taken for them to get to this stage, because generally parents and caregivers are really devoted and have spent a lot of time, energy and money to get your child to where they are. And sometimes adolescents aren't always aware of that, because developmentally it's kind of appropriate, they're in their own world. But for this particular situation, you do want them to be engaged, because this is ultimately about them, and we want them to be successful as they become adults. And then this is an example of just a basic checklist. It's looking at the knowledge side of helping to understand where an adolescent is in the process of becoming independent with their healthcare needs. So, asking them the reason for taking each medication that they have, and for them to be able to describe why it's important. Obviously, again, some of these things are so complicated, and especially with the names of medication, it can be really confusing. So this is not something that an adolescent needs to memorize. Most people have phones, or again, if you've got a big binder that's got medical information in it. There's also, I've got further along another checklist where you can just write in what your different medications are, and you can take a photograph, and it can be on a phone. So if your adolescent has a phone and they're going to an appointment, or say they end up at the ER and they can't remember what their medications are, they can just flick to that document in their phone and say, here's all of my medical information. This is who you need to contact to get more information, but these are the medications I'm on while we're waiting for somebody else to come to the hospital. And this is it. So this is the medical summary and emergency care plan. So this is a really good idea, especially living in Alaska, where we have so many different natural disaster opportunities. We've had so much flooding recently in the northern region, but we can have volcanoes and earthquakes and just snow and wind and all kinds of stuff. So thinking about, where are your medications kept, and helping the adolescent to know who to contact. If there is an emergency and they run out of medications, like, who would you contact for that? And then, like I said, just having these lists of information. What are your allergies? And if you've ever had any surgeries before, this kind of information is really key if you're in a situation where you need help urgently and maybe you're by yourself and nobody's around who knows you well enough to know what your medical history is. And then the next two slides are really just helping the adolescent to think about the different kinds of questions to ask as they're moving from a pediatric provider to an adult provider, learning, about health insurance and having a copy of the health insurance card, knowing how to find out if somebody is in network, because obviously in-network benefits are much better than out-of-network benefits. These are basic questions about even like if you're late for an appointment, how late can you be before the appointment gets cancelled? And then also making sure that the new physician has your medical records, and maybe even talking to your pediatric provider about, can you get some kind of medical summary? Because if you're 18 or 19 or 20 and you've had a medical condition or a healthcare need since you were a small child, your chart may be this thick, and it's really difficult for somebody to go through all those medical records and really see where the key things are and not miss something that might be really important for you to know or for the new provider to know. So it's good to see if, along with giving them all of your medical records, if maybe you can get a medical summary from your previous doctor, but even for you to write down the things that have really affected you or that have impacted you the most over the years, to help them kind of understand who you are. Because the one thing that you'll definitely find when you move from pediatrics to the adult world, so for pediatrics, you've had the same provider most likely for your whole life if you've lived in the same community. And the provider knows what your story is because they've been involved in so much of it. It also tends to be that in pediatrics, providers we do a better job with trying to take care of the whole child and the family, and we're used to parents or caregivers being in the room with us and supporting us and helping. Whereas in the adult world, it can be much more, we expect patients to be independent and they often come alone, and it can be really overwhelming and difficult when you have an adult provider, generally in a facility that doesn't feel warm and fuzzy like the pediatric facilities do. There's generally not fun pictures and paintings on the wall. There are in some adult places, but for the most part, they feel much more businesslike than a comforting place when you're a child and you have to go to the pediatrician's office. So just also understanding, like, there can feel like a cultural difference. It can feel warm and friendly in a pediatric office. There's generally lots of toys, there's smaller tables and chairs. The facility tends to adapt to whatever the developmental need is of the child. Whereas in the adult world, it really tends to feel like as you're going in there as a patient, you should be independent. You should be able to make your own decisions. You should be able to ask questions and get the answers that you need. And it's all very matter of fact. And so just the adjustment from being in the pediatric world to go into the adult world, which feels a bit more sterile, can be really off-putting. And for some adolescents, they'll not want to keep going. So again, trying to establish some kind of relationship with the adult provider where they know something about you and they can understand some of your story can be really helpful in making you feel better about moving into adult care. So that was just a brief summary of some of the checklists and skills and knowledge that's really helpful for adolescents to use as they're starting to learn how to be independent with their healthcare and also as caregivers are learning how to delegate some of the tasks and roles that they've had over the years as they've helped their adolescent grow up, and get the medical or healthcare needs that they have taken care of. Stone Soup Group does have some more transition information, and then I'm also happy, if you want to email me questions, I'd be happy to try and answer them or chat with you more if there's individual needs that you have around healthcare transition. Thank you.